Hello. This is not a story I saw on the mainstream news. I didn't see any content creators discuss it too much either, but you might want to hear about this one. It's about Singapore and what they are doing in relations to Mpox. This is their Ministry of Health website, where a week ago I had an update on public health preparedness for Mpox Clade 1. It says here, as part of a whole of government effort, the Ministry of Health has coordinated public health preparedness measures to respond to a Mpox Clade 1 epidemic. Based on what we know about the virus and disease so far, we are monitoring the situation closely with our international counterparts and are ready to respond decisively should the situation change. Specifically, we're talking here about testing and treatment. It says here that all suspect Clade 1 cases identified by primary care providers will be conveyed to designated hospitals for further assessment and testing. Testing for Mpox is conducted at the National Public Health Laboratory through polymerase chain reaction tests on swabs of skin lesions. To date, there have yet to be a point-of-care rapid test kits that are sufficiently accurate in diagnosing Mpox. Adult cases will be conveyed to the National Center for Infectious Diseases, while pediatric cases will be conveyed to KK Women's and Children's Hospital. Adult child family deaths will be conveyed to the National University Hospital. Cases will be isolated while pending test results. All cases who test positive for Clade 1 will continue to be isolated in healthcare facilities until they are no longer infectious, to prevent further exposure to the community. The treatment of Mpox cases is mainly through supportive care to help manage symptoms and prevent complications. While there are currently no specific therapeutics approved for the treatment of Mpox infection, antivirals such as tecovirimat will be prescribed for treatment of Mpox cases with severe disease. This is aligned with the practice of other public health agencies. Essentially, they are talking about isolating anyone who has this. There's also the vaccination part of it, where basically it says here, for close contact of confirmed Mpox cases, the expert committee on immunization has recommended a single dose of the Jynneos vaccine to be offered and administered within 14 days of exposure to reduce the risk of the disease. This will be administered while they are in quarantine. So essentially, if you are in contact of a confirmed Mpox case, you will be quarantined and offered and administered. That's very interesting, this specific phrase. Offered and administered. Does that mean that you don't have a choice? I'm not sure. But either way, the idea that they will quarantine not just anyone who has it, but also anyone who came in contact with it. Reminds me of something. It's a bit of a deja vu. Now, I have this article here from the World Health Organization about the World Health Organization Director General declaring Mpox outbreak a public health emergency of international concern. And this little story from Forbes, vaccine maker shares soar after WHO declares health emergency over Africa Mpox outbreak. So that's an interesting thing to note. We have soaring share prices for people who make vaccines when they declare emergency, and we have a second disease, like 2 years after the end of the last one, that somehow requires everybody to be isolated. Interesting. It might or it might not go viral and force everyone to shut down, essentially like last time. But it is the season for it. After all, the US elections are quite close to us now. Again, I'm feeling a bit of a deja vu here. I don't know about you. I will keep monitoring this story, and if we actually get any further info, I will definitely make a video about it. There's also a organization called Healing the Divide. It's a Singapore website organization, mainly to do with the 19 jab, 2019 sickness jab, and the after effects and any questionable in terms of legality things that might have been going on at the time. They're advocating for a bit more government and corporate accountability on such issues. And Iris Co, which is, I believe, the founder of that website from Singapore, is asking on Facebook, we wish to know from Ministry of Health Singapore, does that mean that they have the power to anyhowly vaccinate us if we are 21 days in the designated government quarantine facility? Mothership, please help to clarify what draconian measures the government will do. We know that under the Infectious Disease Act, they can, but I hope this is not another excuse to vaccinate us with experimental mRNA injections. So this is wholly her opinion, YouTube. I am not providing my own. It's against the Nuremberg Code, she writes here. They better don't touch me. I suspect this may be a psyop. Isolate us for 21 days and then make us cave to the vaccines. You have all been warned. We should all be very concerned. Help me share and viral, please. And it says here that the MOH also announced that close contacts of Mpox clade 1 cases will be quarantined for 21 days in a designated government quarantine facility, and said close contacts will have the vaccine administered while they are in quarantine. So I'm wondering about this story. I hope we in the West do not follow in those footsteps if this is truly the case, if they are actually doing lockdowns and mandates again. We've just seen that story. We did not benefit. There has been no provable health benefit to any of those measures that I've seen, personal opinion. But yeah, I've seen a lot of graphs and such showing that countries that locked down did not fare better, and vaccine and mask mandates did not noticeably improve health outcomes either. Again, your mileage might vary. That's just the info I've seen, personal opinion. Not at all medical advice, but to me, this is the last thing I need right now to return to 2019-2020 days. Definitely worrying. Anyway, thanks for watching. If you have any information, you can add it in the comments. I'd love to hear from you, and see you next time.